Hello, Psyche community. This is Dr. Fatima Sadat, Medical Science Liaison for Otsuka Pharmaceutical Development and Commercialization Incorporated, and I am joined here today with Dr. Timothy Aungst, an Associate Professor of Pharmacy Practice at Massachusetts College of Pharmacy and Health Sciences University. He is also a clinical pharmacist and a digital health advocate in the pharmacy space. Today, we are here to discuss digital health endpoints and medication optimization. So let's dive right in. Dr. Aungst?
So as Fatima mentioned, this was my introduction. So background is I've been a big passionate believer in the use of technology in healthcare over the years. I've served as an editor and international and national speaker on the use of digital health and kind of trying to take in consideration where we are going in terms of healthcare design and implications, especially within the pharmacy practice space. So one of the big things I'm a big believer in, especially when we talk about in terms for pharmacy, is really this whole aspect of medication optimization. Oftentimes, I feel this is expressed primarily as medication adherence, which I would say is maybe a big misnomer because the reality of the situation is that medication optimization encapsulates not only medication adherence for a patient, but also other drug-related problems such as duplicate therapy, side effects, and things like that. Taking in consideration, medication optimization can be viewed as a patient-centered collaborative approach towards trying to reduce these issues and helping manage medications and basically improve therapy overall. This is substantial cost across the US. What we do see is that it probably represents, as of 2016, almost $500 billion, which now in 2020 is probably much higher. And it's about over 15% of the total US total expenditure for healthcare. So there's a large amount of opportunity for making novel developments and changing this paradigm compared to how we currently practice therapy. So what this thing goes into is what I would say is a digital medicine. And this is looking at a tool for the measurement, intervention, and the service of human health. So take, for instance, that whole aspect I mentioned in terms of how we want to optimize medications. We have these different digital tools and digital medicines out there that basically are being FDA cleared and approved. And this is basically hardware, software that can help things such as treatments, disease prevention, recovery, and health promotion for patients. It's just a matter of what is the best for that person, such as, what's the best medication to prescribe for a person. You have to take into account all these different aspects. And digital medicines are very much like that, not necessarily just a pill or a surgical intervention. It could be an app, it could be some other things. So the utilization of these digital medicines implies that we are now getting to different endpoints. Oftentimes when we think of if we were to do a analogous kind of thing, would be like we use a medication and we were treating, let's say, blood pressure, we're trying to look at a reduction of the vitals, systolic or diastolic blood pressure endpoints. In this case, with digital medicines, we're also looking for novel, what we would call digital endpoints. And these are being integrated into digital studies, trying to demonstrate what is the evidence for their supportive use. A lot of this is still exploratory, but we are finding some very novel endpoints that we can utilize that we would really never thought of before. And this is where we're seeing different manufacturers and different people investigating randomized controlled trials trying to look at these endpoints. So these could be things that happen in real time for patients that can help demonstrate how well a disease is being treated, or even if there were new ways of actually thinking about how symptomatic a patient was in the past versus a current, because we can have a more, what I would say, a real-time outlook on the patient collected through digital technology versus generally intermittent care where we collect information time to time. And this is where I think we then go into. This is where then you arrive. You start looking at this whole, let's say, cyclical nature of continuous care through using digital medicines, and in the nature of pharmacy space and others that can help out with medication optimization. And what you look at then is that a patient would continually be assessed. So data flows in from multiple different endpoints. It could be a smart pill bottle, it could be ingestible sensors, it could be wearable devices that are just collecting information in the background. And this information just constantly flows into, let's say, a central system that's being reviewed. And if everything's fine, if the patient is achieving the desired traditional endpoints, and let's say now novel digital endpoints, and the patient's reporting that they feel like their health is good, and it looks like they're doing everything appropriately, then there needs to be no intervention. basically data just confirms that everything's correct and that we're fine. But what happens is if this data flow demonstrates that things are not appropriate and that are not being the way that we want in real time, then we can intervene. And this intervention now implies other things that we never really could have done in the past at the point of care, even for a person virtually, instead of having to come back into an office as such. We can now have digital therapeutics be utilized. We can use apps, we can use different software, hardware. We could do remote cognitive behavioral therapy. We look at telemedicine services now just going in there. And then basically, as the system develops and as you make interventions, it's still a closed loop system. So every little new nudge, every little change is still being tracked to see if it leads to the desired endpoints that are going into it. So I think that's the big thing is we're talking here is this whole push is this cycle of where patients continuously being monitored, assessed, and treated, and when things are not reaching the endpoints that are desired, then the intervention happens. And this could be noted by a patient. It may not even be noted by a patient. There may be some simple nudges, or maybe then a human face intervention. But I think this is very much going towards this whole system of really for digital health, how it will be developed. So we had different ways of helping out with this optimization, especially with medications. We're seeing tools that basically can help with increasing adherence for the patient. And through this, we can see reduced costs and efforts related to medication optimization. We can help provide more accurate adherence measures for healthcare practitioners. And I think this will also help empower the patient to help engage in real healthcare. And this is probably a big shift, I think, in the nature of, let's say, a paternalistic method where people tell a patient what to do, but now they actually get real-time feedback in terms of what they're doing and how it impacts their own health. So it comes back to this, the whole ownership of smartphones, the widespread adoption of the internet, access to Wi-Fi, LTE, and soon 5G technology, just to basically almost interconnect almost all this stuff that allows this premise to come to fruition. So if I was to like focus, for example, depression to me is a disease that I think we could argue has historically suffered from very much historical bias from a patient to give a subjective analysis of how they feel their own care is going. Asking questions, doing surveys and such would then imply some recall bias. This would go even into medication adherence. But now if we look at this, we have a number of digital interventions that can help monitor and encourage adherence to patients with depression and monitor symptoms. These include like smartphone apps. We have seen electronic pill boxes and pill bottles that have been demonstrated to basically help with adherence, and they have been seen in trials to then decrease symptoms of depression. We have novel electronic ingestion markers embedded pills that can record medication intake in real time. And then we have sensors for smartphones and wearable devices that can be used to collect physiological data related to depression, such as mobility and sleep. I mean, I imagine a time period now where we are here and we can say, you know, if you did a change in therapy, you added a medication, you up titrated something, and then you wait a little bit to see the patient again, ask, you know, how do you feel you're sleeping? How many hours are you getting a night? You're more well rested, you're moving around. But now we can have objective data. And going back to the whole digital medicine cycle, you can say, yeah, we started treatment and after 3 or 4 weeks, this person's sleep improved. You can say, you know, what the changes we did was probably significant and what did it. But if it didn't, then you have something to say, well, we have objective data to demonstrate that maybe what we thought we were doing isn't exactly working. We have to try something else for this patient. So in many ways, we have many ways to recommend new ways to modify therapy based on these tools and data that can be collected from these e-health advancements. Next thing is also sleep disorders, I think also goes with it, and very analogous to depression in talking about, we have a number of wearables and mobile applications that can allow for symptom tracking in psychiatric disorders and assessment of sleep patterns. We can have smartphones that have embedded sensors that can facilitate this data acquisition because there's an accelerometer in it. You know, if I take a phone and move it and such, it can detect once that's done. If I were to lay on a bed, it has an app there. If it detects me moving, it can feel that it's moving as well and say this person's awake or such, especially if it's erratic and not demonstrating someone like in REM sleep. So definitely huge advancements taking place there. And this, of course, also can change the different prompts we have in terms of addressing this patient's sleep and how it relates to other comorbidities. So another example would be non-adherence in schizophrenia. So we saw in a recent systemic review of 39 studies that 41% of patients with schizophrenia are not adherent to treatment. And this can cause a lot of issues. Not adherence, really, if we look at the health system overall, we see inpatient hospitalization costs go up. We see a lower quality of life associated for patients. And the reality is this non-adherence can lead to basically a number of increased relapses that can cause rehospitalization for a patient and possibly lead to self-harm. And these are all things that we'd like to avoid for these patients. And the one thing is, how do we know if they're taking medications and how can we help out with this? There are a number of solutions that we can turn to and now that is available with digital medicines is that we can have electronic reminders, we can have SMS or short messaging system, text messaging to help remind patients. We can also have sort of pill bottles. We can have digital ingestible markers that are embedded in medications that can all basically help us tell if the patient's taking their medication, also to remind them. And I think these are great advancements in terms of this is new novel solutions that we can offer that we didn't have available in the past. And these digital tools all tie through a smartphone, and they offer new modalities that can basically help out with this automated data generation, coming back to this whole digital medicine cycle that I talked about in the past. And this has been shown now to assess symptoms more accurately. We're getting able to identify and monitor signs of relapse before or when they're happening, and then we can monitor treatment effects. And this stuff is very valuable then for us to help drive better patient care in the long run. That can then go back and reduce rehospitalizations and potentially reduce costs and such. But it's not just with mental health disorders that we need to talk about, and we're seeing this across the board. Some examples I want to talk about here, just to give you an example, is Parkinson's disease. We're seeing a number of new ways that we can detect movement disorders with these patients based on radio frequency, motor fluctuations and gait through wearable devices and such. And what this then does gives us a better objective measurement on the outpatient side to say if the patient is doing well with treatment and such. And I think this is a great example as well to talk about how we're seeing this is modernizing clinical trials because of these digital endpoints see how well they're doing on the outside. This can lead to better clinical study design and outcomes, and we can really, I think, helps us better monitor treatment and say how effective new devices or new drugs are coming out as well. So expanding further with that, then I would say respiratory disorders, we've also seen a number of examples where we can see a medication also tied with sensor-based technology to track adherence. And this is being done a lot of asthma and COPD. And when you look at this, historically, patients basically would self-report, their symptoms and how often they're using their inhalers. You could always look at the inhaler and kind of backtrack, how often they use them, but when do they use them and why do they use them? This is stuff that's hard to determine. But now we have FDA cleared sensors that can basically say, hey, these patients in real time are using these inhalers at this GPS location. You could look at, what was a pollen count or what was the how much pollution was there, the time of day and such, and then patients can record how they felt and if they got any better. And this has been really valuable for pulmonologists, for instance, to actually say, oh, wow, this patient's, using their inhalers, especially like the rescue inhaler, more frequently than I would suspect. And these may be potential triggers, and this is stuff we need to address with them before we maybe add on new therapy because we had this data to go back to. And I think altogether what we then see is this point where we have all this data aggregation. I would still say that we're trying to develop really what is the best way of navigating this. And what's very key for us as pharmacists is knowing what tools are available and what drastic changes I would say are happening and how we even review medication adherence and medication optimization through all this data that can be collected. In many ways, I think that there are potentially new roles for us that can expand that we can assist patients in selecting and setting up these devices, these apps, or basically help serve as a tool to help guide providers to know what to utilize. I think that this real-time data collection and this continuous cycle of digital medicine is something that we can also be part of where we can see symptoms, adherence, and kind of track that in real time and help patients achieve their healthcare goals. And the reality is monitoring medication adherence, I think, is probably a big thing that objectively will increase with all the new developing technology coming out this time. So in conclusion, as you can see, I see that there are many new digital endpoints rather related to diseases, adherence and such that can really help us optimize therapy going into the future. So this is Timothy Aungst, and thank you for your time.